So, hi, Kiro. Welcome. Just tell me a bit about your role in East Africa, Ethiopia. You're from Ethiopia.
Yes. My name is Kiru, and I live and based in Ethiopia, in Addis Ababa, and I serve with East Africa Sending Office, mobilizing the East African Church towards global mission.
Mobilizing the East African Church towards mission. That is fantastic.
Ethiopian Church, Kenyan Church, Rwanda, Uganda, along with ASEAN partners. To go out and serve. So the vision and the goal is to help the church to be able to send missionaries in a global setting and empowering the church by supporting them in different manners.
That's exciting.
To send now, and so that they can have strong sending structures and understand the mandate.
Oh, that's exciting. So I come from a member care point of view, so preparation and on-field care.
Yeah.
What are the main issues for Ethiopian missionaries or Ugandan missionaries?
Well, member care it's a broad term, and it's something we're learning as we send more. And this is it gives us an opportunity to work with the church, to share with them what we mean by member care. How can we deliver member care? It's a huge gap, I would say, but something we're learning and helping the missionaries we have on the field and those we recruit, and also encouraging church pastors and mission leaders to consider different angles and different methods, adapt that, and help them missionaries to continue serving on the field for a long term.
We see there is certain strength in national mission movements and also needs. So what is the strength of the Ethiopian mission movement?
Yeah, for example, majority of our missionaries sent from Ethiopia, they are determined in engaging in the mission. They're not afraid to go to the dark places and vulnerable places. And sometimes I would say our skin color and our experience back home in Ethiopian context give us a platform to reach unreached communities. Really, it's been a blessing, and we try to engage, focusing on the unreached, such as the Fulani people groups and others, reaching out to them to share the gospel. Unless we send them, and they will never have a chance to hear.
So working with the Fulani, you have perseverance, you are equipped. What would be a particular member care need that you could identify?
Well, I would say in areas of resting and an area of understanding the cross-cultural context, engaging and working with a multicultural team, and also caring for the children's, the mothers, and also most of the time from our context, husbands are the one that goes out. So how do we care for them, considering the health, the mental health, and the challenge they're facing? And when we say member care, it goes broader. It goes to the finance, we go to the person, the individual, the family, the team. So I'm just thinking it's a broader term, but as each missionary is engaged in a field and face challenge, trying to bring a solution and support towards that so that they can flourish and engage for long term. Because these ministries need long-term placement than short-term, 10 years or more. So as we deal with the issues, family issues, children's education need, health issues, and also we talked about the grief and all this process of going through different cycles. So trying to be specific and use these resources to address the need as needed.
So perseverance as a strength, going to the dark places as a strength, and at the same time, broad member care perspective needs that are not just one-on-one counseling, so to speak, but finances, church support, etc., family educational needs. Yeah, great.
I think it's also important to make sure the church back home understand the challenge. And sometimes it's easy for an individual or the missionaries to share their need, to say that I'm not feeling well, I'm feeling distressed, and I'm facing this challenge. So if we address it, the church pastor, the mentors could help in dealing with these issues. And also addressing the church community means family and friends, so they know how to help in dealing with critical situations. So it's a broader aspect, but we need to address both the missionaries and the church and the partners as well. How can we help missionaries sent from our context?
Well, thank you so much. We are having a global member care consultation in East Africa, actually in Kenya, Nairobi, where we talk about exactly these issues. We bring the whole world of member care together, learning from the African continent. You really want to learn about your strength in member care, and also for the whole world to contribute towards member care learning for the African continent. Give and take.
Yes.
So we're looking forward to having you there, hopefully, and having many of you there as well. Okay, thank you so much.
You.
And